I'm grateful to Mabon for bringing this debate forward today and to share his concerns about some of the issues that the hospices are going through, because it's really important that we have this debate today. Last week I was really glad to accompany the Minister for Health on a visit to St David's Hospice in my constituency in Newport, and I'd really like to put on record my grateful thanks to the Minister for taking the time to come and listen to the staff at St David's Hospice and the team around there, and your interest in their work. I know that that's very much appreciated by all of them. And I'm very grateful to the inspirational Emma Cecil, who we heard from, and her team for taking the time to welcome us to that. St David's mission is to provide and continue to develop a free and comprehensive palliative care service of excellence throughout South and Mid Wales for people, their families and carers facing a progressive and incurable life-limited illness. The hospice takes a whole-person approach, and the service is delivered in cooperation with other agencies. Last week was not the first time that I have visited the hospice, and I know from personal experience that the staff deliver high-quality medical care, as well as providing invaluable, empathetic support to their families. It really is hard to put into words the quality of care given and the heartfelt appreciation by patients and families to St David's. They are experts in talking about the delicate but important subject of death with people of all ages, and the hospice's unicorn service for children and young people is receiving more and more referrals from schools. Last year, 3,498 patients and families were cared for by St David's, more than 25% of whom had a non-cancer diagnosis. More people are cared for at St David's and by St David's than the Royal Gwent, Neville Hall and the Grange hospitals across the Aneurin Bevan Board area. This is the equivalent level of the provision of 46 wards based on a 30-bed ward, and that really is quite astonishing. Over 34,000 hours of care were provided by St David's Hospice at Home service last year, enabling patients to remain in their own homes if that is their choice. 99% of patients who received hospice at home care were able to die at home. All of the care provided by St David's Hospice care is free of charge. However, it costs £13,500 every single day to provide that care. The hospice receives funding from the NHS and Welsh Government to support their work, and it boosts this public funding with donations from the general public, legacies and grants from trusts. As demands for its service continues to increase, St David's Hospice Care anticipate that they will end this financial year with a deficit of £262,000. Charitable hospices across Wales, including Tŷ, which I've also visited, are facing similarly stark financial pressures. Whilst I appreciate the very difficult budget decisions that the Welsh Government is having to make, and I know that the Minister is really acutely aware of the precarious situation for hospices, patients and families would be really grateful if the Minister is able to provide some clarity on the future funding mechanism for hospices in Wales. And can the Minister put on record her thanks for the incredible, invaluable work that St David's and other wider hospice care give? Diolch.